Thanks for joining us this afternoon. Just to give you a little bit of a background, I have been doing workforce development for the last 15 years. My background started in the preparedness arena, and we at the MidAmerica Center for Public Health Practice, the center is housed at the University of Illinois at Chicago, have been working with the state health departments and local health departments in assessing and identifying needs and developing training plans for locals and the state for the past 15 years or so. My role today is to really just give you a quick background of where we are, where we started. Let's see if this works. Articulate the state of the public health workforce development in Illinois, to tell you where we are going, and then share some resources to help those of you that are interested in continuing this, and hopefully that's everybody in this room, to do that. Just a quick show of hands. How many of you are from local health departments? Okay. And how many of those local health departments have workforce development plans in existence? Excellent. So I'm not going to go in too much detail, but just so that we are all on the same page. Workforce development is about improving health outcomes by enhancing training skills and the performance of the workers, those that are going to be implementing the programs, the policies, the systems in which we are trying to improve. So back in 2013, 2014, at UIC, we were funded a NACCHO grant to take a look at the workforce development in the state of Illinois. And so we employed a qualitative method study that talked to local health departments throughout the state to get a better understanding of, where were we? And now, remember, this is a good number of years ago. Miriam's going to talk about what's happening today, but this kind of gives you an idea how we've been progressing. So the purpose was to explore the factors that contribute to the health, to Illinois' readiness in workforce development. And it looked at a few different ways, a few different things. But what we did find was that everyone in Illinois is committed to training. We believe in it. That as we're not 50th in the nation. We're doing well, right? We believe in public health. We believe in training our workforce. The reality is that there's usually not. A lot of the trainings are mandated trainings. They're required. They're not because they're the current need, and they're not on cutting-edge topics, which I think is very ironic that I say that as we sit here and talk about Public Health 3.0 today. So clearly we're making shifts in strides from a couple years ago. I have the whole report if anybody wants to take a look at it. But really, the other thing that came out of it were the recommendations that were pretty important. And one of those was to develop a statewide public health workforce development task force. So local health departments have been looking at their own individual trainings. The state had been looking at state level trainings. There was efforts at different time periods in Illinois where we tried to look across, but it never actually congealed as we wanted it to. Also, we wanted to talk about how can we leverage all the trainings that already exist and communicate all the efforts that everyone's been doing. So just because you're doing something in environmental health, why does your neighbor have to do something in environmental health, and so forth and so forth? Why couldn't we leverage all the work that's happening across the state? And of course, we all know about the FAP standards. So this was mentioned this morning. PHIST came about because back in 2016, I believe it, in October of 2016, when the state was in a big fiscal crisis that was really impacting public health, we all came together and said, what can we do? What can be done, right? And it's a lot of what we just heard. It's like we were at the bottom. We know we were losing staff. Local health departments were having to shut their doors for days. I mean, everyone's aware of what was playing out. But we all knew we had to keep doing the work we were doing, and how could we do that? So public health is stronger together, came together, all these agencies and associations to basically strengthen governmental public health. What can we do together as a collective? And for the past 2 years, as was mentioned this morning, there's been a lot of work that these groups, taking into account information from all the stakeholders as much as we can. And this is, we're not saying that we're speaking for everyone all the time, but we're trying to. And so we identified these focus areas. I'm not going to go into great detail, Miriam. I don't know if you want to share anything more about the focus areas. The focus area that we want to focus on today is really about looking at workforce development. We realize that we need to put some concerted efforts into what we are doing to training our workforce. How can we, we have turnover, again, all these things that Miriam's going to go more into detail about, but what can we do to make sure that our public health practice is strong here in Illinois? So in April of 2017, IPHA decided to develop a workforce development committee that was dedicated to looking at this at a state level and seeing what we could do as a collective. So from April to June of 2017, we recruited members. We invited anyone through all of these associations that were interested in participating to be part of the Workforce Development Committee. And we launched it, myself and Christina Welcher, who's the director of the MidAmerica Center, who you'll hear a lot more from later this afternoon, launched the committee with the help of Miriam to really start taking a look at and seeing what we can do. The Workforce Development Committee decided that they were going to focus on a workforce development plan that we're going to talk a lot more about later, but also developed 2 work groups. These were identified needs, so communication. So the communication work group had actually started right after that 2016 meeting in October, when we said, you know what, we do a really bad job of really saying what the value of public health is, and how can we better do that. So there were toolkits that were developed. If you haven't seen that, I'm happy to share that information. There were also a number of trainings, and the communication work group continues to say and see what is needed, working with the state health department, PIO groups, and the like. The other thing that we heard a lot about was leadership training. And you see it all through, and you're going to hear about it all through the next 2 days, that we as chief health strategists, we as leaders, we need to talk about change. And these topics are hard. They're not, it's not an easy way to move forward. And so how can we provide that type of leadership and understanding? So the new administrators group, which actually, that's how it started. When we started coming together, we decided that we needed to change our name and became the Public Health Leaders Group. And we're working on developing trainings for public health leaders that really give give the local health departments basic understanding of what everyday administrators do, as well as what they may need to move to the next level. So many of you in this room are from local health departments. A lot of you have done workforce development plans. I'm just going to review, the basic steps of a workforce development plan. Kyle's going to share a little bit about his experiences as a local health department, and then we'll talk a little bit more at the state level. So, how do you start? Where do you start? The first thing to do at the local level is to develop a work group or a committee. Remember that you want that it's not one person. It can't be one person's mission. You want the whole agency to buy into the fact that we need this plan and we need to make a change and we need to find these trainings to become the best that we can be. One of the things that we've also heard a lot about is that you can't mandate this. It has to, and it can't be, so that it's tied to job performance reviews and the like. That this has to be something that becomes kind of a culture within your organization, so that you're talking about continuous development of each of the staff or employees or whomever, so that there's growth at all levels. And I truly mean that. That development means, it's not just for your staff, but for your leadership and the like. Who should be part of this work group? These are some of the, you want to make sure everybody at all levels is sitting at the table and talking about it, so that when you go to implement the workforce development plan, everyone's already bought in. And again, come to an agreed, and I feel like I'm preaching to the choir. I feel like there's things that you guys have all heard, but why are we doing this? And sometimes it could be as simple as, well, nature requires it for accreditation. Let's focus on that, and let's get at least our groundwork in place. Maybe it's about quality improvement. You know, our numbers are dropping somewhere. Maybe we need to do something to take that, you know, take the next step. Next step is assessment. I've done this presentation. I could spend the whole 2 hours talking about just doing a workforce development plan. As I mentioned, and for those of you who may have walked in later, we have developed resources, and I'm always a resource for you. There's multiple ways to do assessments for your agency. The Council on Linkages Core Competencies is the most typical assessment that I think almost everybody in this room is probably aware of. You can use that as a paper survey. You can create an online survey. If you want, you can always reach out to us at the MidAmerica Center. We've offered our services to many of the local health departments through our online system. So there are various tools. When you're ready to begin the assessment, figure out who you're going to assess and you know, at what levels you want to assess. So the assessment is developed in tiers. Do you want to assess all of the 3 tiers? At this time, do you want to start with one small subset? You know, what's important now? What's the capacity now? And then where can you go from that? Looking at the assessment will help you identify what your needs are. But there's more than that. There's always all these other needs that always exist in any organization. So if you're funded by grants, the grants will identify needs that you will have. If you have, you know, if your agency is moving in a different direction, there's always going to be, you know, what can you do to better serve your community? If there's a local need, an environmental need, if you realize that the population that you're serving has a specific need, all of that needs to be taken into account when you're talking about identifying your needs. So you can't just do a competency assessment and say, here, this is, you know, this is what my staff needs to learn. You really have to look at the big picture and account for all that. And this is, you know, if you have a strategic plan for your agency, this is where a strategic plan would come into play. And then to put together, you know, all the additional things. The big one is money. How much money do we have? How much time am I going to allocate? Who can, you know, where's the biggest need, and where can I focus on that? And how often are we going to do this? Are we going to do this assessment annually and train annually? Are we going to do this semi-annually? You know, and then to prioritize all of that. And, you know, they say the devil's in the details, right? It's easy to say a lot of this stuff, but to get it down on paper and actually move forward, it takes the team. And that's why you need to have brought everyone to the table from the beginning. To meet the needs, where do we go for trainings? And we're going to talk a lot more about that later. There is a handout, and I realized as I printed it that it's completely useless printed because all of those resources are hyperlinks without the actual URLs. So I will be sure to include that resource with the PowerPoint presentation when it's posted on the IPHA's website. But most of these you should be aware of. I also, if we have time as we go through questions, I've pulled up many of these resources already, and we can walk through them after the presentation. And you know, the biggest conferences and learning from your peers. It's a huge resource, and I think so. One of the things that we're looking at with the Public Health Leaders Group is to figure out a mentorship program and how we can really connect everybody within Illinois to learn from each other. And then developing the actual training plan. One of the templates that we highly recommend, which is also listed in the resource, is the one from the Ohio Center for Public Health Practice. They have been a partner of ours, and they're part of our Region 5 Public Health Training Center. They have a Word template. It's very simple. You take all the pieces that we just talked about and you fill it in, and it really walks you through it. There are lots of other examples. I think, you know, got one today. There's NACCHO's website has a number of examples listed. So, you know, and then if you ever need, we can always help you. I'm going to hand
leave
it over.
On there. No,
Whoop,
that's okay. I'll try to stand still. I tend to wander when I present or facilitate, so I'll try to do my best to stay behind the podium. Hi, I'm Kyle Auman. I'm the administrator of the Ogle County Health Department. I wouldn't call myself an expert on workforce development plans, but somehow I got deemed one. I worked on workforce development for two different health departments now, starting with the Winnebago County Health Department a couple years ago. And I want to talk about a couple different things, but just kind of my experience mainly overall. I think that getting the staff excited or interested, minimally interested about workforce development, I think is critically important. While I was developing the first iteration of the workforce development plan for Winnebago County, it was hard to get staff's buy-in or get them excited about the process. We were going through FAB at the time. We had a number of different larger initiatives and projects going on, and so to get them excited about one more thing, especially the leadership, who was a majority of our committee, was very challenging. And so I think that taking the time to get staff to understand why a workforce development plan is important and really demonstrating that, I think you have to do it. And so I experienced challenges there. My staff in Ogle County right now, we're getting there and getting them excited about training and development and learning new things. I have a very young staff, so I think it's a little easier to do, whereas in Winnebago County we had a lot of people there that were there for 20, 30 years, and so getting them to formalize what I think that we were already doing in Winnebago County. We were doing lots of trainings. All the different departments were doing lots of trainings, and we just weren't documenting how those were done, or we didn't have an overall snapshot of the department. Each section or division or center had things that they were doing. Maybe the leadership of those centers knew what was going on, but looking at it holistically from a whole organization wasn't being done. And so now I believe they are. So it helps if I switch to my slides, I suppose. And I am going off cuff with a lot of the conversation here. I didn't go into detail in a lot of my slides, but so the next, Guddi had mentioned going through the assessment. Going through the competency assessment, and we use the Council on Linkages that Guddi had mentioned. I use them that assessment for both the tiered assessment. I understand, and I haven't seen it, but I understand there's a consolidated or a simplified assessment now. I would like to see that, because it does get a little challenging to figure out who is in what tier. You know, is this intake person and this clerk in tier 1, or how does that play out? And so a simplified version of that, I think, would be helpful. I'm interested to see that. But a lot of interesting things have come out in my assessment, in the assessments, especially in Ogle County. I found out that one of my intake clerks was interested in finance and management, which is like, you're a frontline person, you're dealing directly with the clientele every day. You don't do any management, and you have very few financial responsibilities, but you have an interest in it, and you know something about it. And so she scored very high on the competency assessment. And in talking to her, you know, another thing that you have to educate your staff on is why you're going through the competency assessment. A lot of times people think that they're being graded on their work performance, or we're trying to look for a way to set them up for something. So I spent a lot of time explaining to staff that this is really an organizational snapshot, or a look at how we're going to be moving this organization forward. But in that assessment, in talking to this individual, she did have interest and knowledge and working experience with finance and maybe some management at some point in her career. She is now doing most of our billing for insurance and Medicaid and public aid, and she's doing a wonderful job. And so that was something kind of like an unintended consequence in going through this assessment. I learned something about one of my staff members, and I've actually learned something about all of my staff members. So like I said, kind of an unintended consequence, you're learning more about your staff, not just for your plan, but day-to-day operations. The other thing that Guddi talked about needs, and really trying to understand your department needs, and that comes from the assessment. You have the programmatic needs, grant needs, things like that. But then with my plan for Ogle County, was really trying to understand the future of where my department is going, and thinking really a future-focused plan. And what would I have, like I said, I have young staff, people that are new to public health, people that have a little bit of experience in public health but are are steering into other areas of public health, and so they're going to need a lot of training. And so, and thinking about cross training too. In a smaller department, my department is a department of 15, and so. My nurses in the past wanted to be a WIC nurse and just a WIC nurse, and so really educating. I know you're a public health nurse, and you're gonna learn all these different areas, and you're gonna receive training on things other than just WIC and family case management. And so, thinking of the future. That this cross training is going to be the only way that I'm going to be able to operate and maintain my budget and be successful. So, whereas in a larger health department, you may not have some of those worries. Divisions or centers are more segmented. People have very specific jobs. And so that's something to think about when going through your workforce development plan. What are the needs of your organization? The size of your department, the current structure of your department will all play into that. So Guddi's kind of talked about where we start, and we're going through where we start here. The biggest challenge, I think, and the biggest takeaway, and hopefully we're going to give you some tools here. My biggest challenge, anyway, was coming up with. I was able to get through the committee, able to get through the assessments, able to prioritize my needs and think about the future, and all the things that I'm talking about really came easily. And once you get people excited about it, you can drag them along, right? But where do we get all these trainings? And iTrain is a great resource. And what are the training needs of, say, a food inspector? I think in my workforce development plan, I have over 30 trainings that are required to be a food sanitarian. How do I centralize that? I mean, I spent hours. I can't even tell you how many hours trying to find all these different. What's a nurse need? What's a WIC nurse need? What's family case management? What are those needs? And so I hope that one of the outcomes that we can give you and reduce the time that you spend on your developing your workforce development plan is those training resources, so they're in a centralized location. I think that there has been a lot of, in the PHIST work group, there's been a lot of discussion about, what do we do, what can we do to remove the barriers of developing a quality workforce development plan, and I think that's one of them, is plug and play trainings, for whether it be iTrain or whether it be IDPH web portal or wherever we're pulling the trainings from, just a list of these so we don't have to recreate the wheel each time we develop a workforce development plan. See, I just want to make sure that I covered all of the things I wanted to cover here. I think that's all that I had currently. If there's anything else that I'm missing, I'd be happy to try to fill in the blanks or answer any questions about the local public health department perspective.
Any questions at this time?
I have a question.
Yes.
When you did the competency assessment, was it online survey or were you meeting with your employees individually, or how do you do that? Because you said you found a person that has interest in finance.
Mm-hmm. There's a PDF fillable, and you basically grade it after they answer the questions. And then I did a gap analysis, took all of them together, did the math, and did a gap analysis, and had the web, developed a gap analysis web. Guddi and I have been talking. She takes it one step further with kind of the perception of the department and.
So the competencies are written about your skill, knowledge, and attitudes about each topic or each domain. And what we did with, and actually, Kevin, you're sitting back there, so feel free to jump in. So we did not only how you feel, how confident you feel in your ability to do X, Y, Z, but how relevant is it to your position. And then with that difference, you can actually identify. So say, I'll give you an Excel is not one of your public health competencies, but let's use it for simplicity, though maybe it should be. Do you know how to make a pivot table in Excel? And somebody could say, and especially in this scenario, yes, I feel very confident, but is it used in your day-to-day workplace? No, I answer the phone every day. I never need to make a pivot table. And so how important is it that we find a training for this subset of people? It's not part of their day-to-day job. Now, in this situation, this, outside where they could then be, put in a different position, or we could look at, maybe the skill doesn't need to be here as something because it's not used in your day-to-day. So there's lots of ways to look at this data. I don't know, Kevin, if you have anything to add.
I just think we found that very helpful work that Guddi and her team did in terms of drilling down into it a little bit with more specificity. As she said, if I don't know this, but if I don't need to know it, and I have so much time to spend on training, let's put that training time to the thing that's relevant to the position. And that was self-identified by each of the people that filled out the survey instrument. So they would do the core competency assessment, so how confident I am, and then how relevant is it. If they're very confident it's not relevant, who cares, in a sense. But if they're not confident in it and it's very relevant, we care very much. And then it helps us prioritize topic areas for our workforce development plan overall for classes or groups of employees. Individuals could always, and that's one thing, I just make a plug for the iTrain program. If you have a competency that you want to train to, you just plug in who you are, what's your classification, what position you are, what competency area you need, and it will drop down any number of courses that are specific to what you feel you need as an individual. Plus, some of them get free CEUs. So for our nurses and others, it's a nice way for them to tailor their individual training plan. And it's based on a lot of the work that Guddi and your team did.
And I would agree. I'd also plug iTrain. We're using that. One of our areas that we've prioritized is the public health, the science skills. And we scored lowest on that in our competency assessment overall as an agency. And most of my staff, especially like the tier 1, had no idea what the public health sciences were and how they relate to their job. We found a CDC training on iTrain. It's a 6 training series, and my staff is almost complete. That was my focus for year 1, was completing the 6 trainings. Most of my staff has completed all of that, and we've had open dialogue about epidemiology, or it's interesting to see frontline staff who've never had any exposure to the sciences then starting to talk about epidemiology and the process, and it's really fun. And then they're well, how does that impact me when I answer the phone when someone calls and said they're sick? Or it's a good point. Let's create a process. Let's create a plan as to a line of questioning that you would ask, and they would answer, and then we'd filter them through our department. Where do they need to go to CD? Do they need to go to the foods program? So a lot of interesting things happen when you formalize a workforce development plan, and it's been a very good process for us. But iTrain has been a blessing, because it'd be very difficult to go out and try to find these individual trainings or bring someone in. It'd be very costly to bring someone in and offer all of the trainings that are offered on iTrain. So, yes, sir.
So you were talking about developing list of trainings for job titles, if I understood correctly. So are you saying there currently isn't a list of trainings out there for a WIC specialist, and if not, is the list that you created available? And how did you
do you want me to do that?
I have not found one that was created before what we have here, and Miriam can maybe talk a little bit more about that. But there are, in some of the grants, there are required trainings and things like that, but as far as a centralized overview of the whole department's needs, required mandated trainings, I have not found anything like that, and so hopefully that's what we're creating here.
So
go ahead. You go right ahead.
So, let me introduce Miriam Link-Mullison, and why am I here? I'm retired from a lot of years in public health, but I also work contractually for the Illinois Public Health Association and work collaboratively with Guddi on this workforce development issue and plan, and I've also been facilitating PHIST meetings. So I'm getting paid to do those things and enjoying it thoroughly. I have a couple things I just wanted to mention. When the health department that I used to work at did our assessment, we also included additional questions besides the linkage competencies. So we wanted to know how our people were doing on different IT skills. Did they know Excel? Did they know Access, database, etc.? And so we added about 5 to 10 questions specifically on those kinds of things. That was very helpful. We also added some real basic questions around preparedness that each person in the health department should know, and so we asked some very specific things. So you know, there is the competency assessment tool is available, but you can tailor it somewhat to your own organization, and you can add questions. As long as you're doing it, it makes sense to ask, you know, a broader set of questions. So I just wanted to mention that experience. The other,
Hillary had a question, so.
Yeah, I'm sorry.
It was just related to the time commitment.
Okay.
Because of the buy-in in itself, I have staff that are cross-trained within the EH departments and nursing overall that provide for all of our programs. But the hardest part is the buy-in not only from my Board of Health, because there's no funding to it, but you're also taking time away that staff could provide a direct service. So that's my biggest challenge to try to get my views. Do you have any guidance?
I think that in Ogle, I have the same issue. It seemed like in Winnebago County we had a little bit more flexibility because, I mean, there were almost 200 staff at the time. I'm a staff of 15, and I struggle with anything that I do. I struggle with how to balance day-to-day operations versus one more initiative. We're going through strategic planning right now, and we're struggling with the same thing. I think that it's, to me, as far as balancing it, I don't have any recommendations for that. My thought is it's something that I have to do, knowing that it's a requirement for accreditation, and I'm committed to, within the next 5 years or so, trying to pull the trigger on accreditation. So I know that it's something that I have to get done. And I think that my thought also is not just that requirement, but it'll also pay off in the long run. I'm committed to having a better trained workforce and improving the workforce. And one of my biggest challenges is the constituents and then also the politicians in my community understanding the need of public health and why public health practice is so vitally important to everything that we do. And so I'm really trying to create the internal public health champions within my department, and we talk a lot about how we have those conversations. If they're asked a question about foods, how do we talk about the science and the evidence behind why we do a food inspection the way that we do? So to answer your question, no, I don't really have a recommendation on how to balance that. I struggle with it too, but the answer is I believe it's so very important, and I think that we're wasting time if we're just saying, let's go out and do trainings and learn stuff. If we put it into a document and say, here's what we're committed to over the next 5 years, then we don't stray from that, and it's a concerted effort, and we're maybe not wasting time. We're saving time by, let's get these 6 trainings done by the end of 2018. 2019, we're going to focus on this. You still have all these things that you do for your job, but fit these trainings in while you can. So I think that if you do it right, initially it's time consuming, but in the long run, I think it may save you some time.
Can I ask a clarifying question? When you, so there's the balancing act of how do you do your everyday job and then add this to their plate, but you mentioned getting it approved by the boards of health. So is this like a fiscal, getting them to say, yes, they can do this, or?
Well, I took it upon myself as the administrator trying to be forward thinking. We need to do this. It kind of got thrown back in my face because we have 2 nurses that provide our 7 programs on the clinical side plus their WIC. So their concept was you're taking away from the WIC visit in itself. That's a reimbursement piece, and that's affecting our numbers. How are you doing that when you're already putting other responsibilities on that?
Yeah, it's hard. One of the things that we did when we did our assessment when I was working is we did it as a part of an all-day training that we do on an annual basis. So the competency assessment itself, people weren't asked to find time to do it. They were given a half an hour in the day to go do the assessment, and we got close to 100% for that reason. And so I think that, it's important to be cognizant of those kinds of things. The other thing I would say is you're already doing workforce development. Every one of you does workforce development, but you don't have, those of you that don't have a plan on how you're doing it. But you're already doing new staff orientation, you're already doing X and Y and Z, and putting together a plan is just going to help you focus that energy and those resources more. So that's where the cost effectiveness comes from. And the other thing, I will continue to plug some of the things that we've put together. So there is a document that you should have that says Illinois State Workforce Development Plan 2018. That's what it says, and then it has this chart on it.
Anybody need that? I can bring it around.
What I have had the opportunity to do that probably no one else in this room has done is I've read nearly every workforce development plan developed by a local health department in the state of Illinois, and they are an amazing resource of information that you don't have to go out and find again. And so what I've put together in this quick document is just some of the things that I saw straight out of other people's workforce development plans that I thought any local health department could find value in. And so several of the plans had in them what are the CEU requirements for XYZ professions. Different health departments have different professional groups, but I put them all together in one chart, and you now have it in front of you. I also saw in several of people's plans what were the required trainings. Now, in their plan, it would be required. There are different ways it can be required. There are things that you're mandated to do by outside entities, and then there are trainings that certain local health departments are choosing to do on a mandated basis, on a required basis every year. So I've divided those out, and I just took these straight out of other people's plans. The other thing that I saw was what Kyle had put together, which was he started to make a list of what are the required trainings for WIC, what are the required trainings for sanitarians, and all of that I've just simply lifted out of their plan and put in this document for you. One of the things that Winnebago had done, which I thought was really interesting, is they had identified additional competencies for these different positions. I thought, you may not want to adopt those competencies, but I thought they were very interesting, and a lot of thought obviously had been put together. So I think in having worked on the last 6 months on developing or working on a statewide workforce development plan, one of my conclusions is we need to do a much better job of learning from each other, because there truly are some best practices that could save each of you time, and that's what I hope this document is. And then the other thing, I'm just going right to this because it seems and then I'll pull back to the rest. And then I just wanted to say that on this Guddi referenced this workforce development resources, and these are hyperlinks, and that, but they're hyperlinks to places like NACCHO. I sure heck that each of you can find NACCHO without us giving you a hyperlink to it. But if you do find it, they have a whole resource center on workforce development, and they have the Ohio template, and they have all kinds of resources. So this is a list of the things that I have found over the last 6 months, and really focusing my time on this, that I think are really helpful and that you should all know about as you move forward on workforce development. So just a little bit about those, and but I'm going to kind of go back and talk a little bit about why we want to have a statewide plan. As Guddi said, the survey that was done in 2014, 2013 basically said, we're all over the place. We're not aligning any of our efforts. Everybody's doing their own thing. We have a very disjointed system. Well, if you've worked in public health in Illinois from 2014 to 2018, it didn't get better. Big surprise, right? It only got worse because there are now fewer resources and disjointed. And so, the bottom line is we have both fewer local and state resources to devote to workforce development, and if we don't align our efforts, we're dead in the water. Because you can't do it alone, Hillary, and you can't do it alone. Nobody can do it alone. And this association shouldn't just be focusing. We should all be trying to blend our efforts together and have better impact. So that's, what we're trying to accomplish by developing a workforce development plan. No one showed me how to use this, so let me just see where we are on our. Okay, so no, I got it.
Oh, that's
so
yours. Okay.
Bottom line: fewer resources, more barriers to effective training. That's why we need to have a statewide plan. Let's see.
You are going backwards.
I am going backwards. Okay. So we talked a little bit about the timeline already. We have this committee that's been formed. We also sent out surveys at the end of 2017 to local health departments, to the different associations, to the state health department, to any of the key players. And we asked the local health departments, what are your priorities? What are your barriers? We asked the association the same kinds of things. We are putting together now a statewide plan, which we hope to finish by June 1st. You'll probably see it a little later in the summer, but we hope to have a solid draft by June 1st. We have some things that we want input on today, so that's what we're going to get to in just a minute. I want to share a little bit about what we learned when we did the assessment, though. I said all these things. And we also, as I said, one of the things I got to do, and, I got to read the workforce development plans from probably 10 or 11 different local health departments. And I have to say, before I read them, I thought, oh, well, somebody's got to look at all these, but really, I don't really want to. It's not like, great reading, but it was great reading. I found them very fascinating, and there were lots of things that are best practice in them. And so, I put that tool together for that reason. So we've also been working with that committee. As we collected information, we worked with the committee to kind of hone in on what was happening. So, did I go backwards again?
You did.
I must have the darn thing upside down. That happens. Okay. Usually, I'm teaching a class right now in the master's program at the Southern Illinois University, the MPH program, and usually it's all like 20-year-olds in front of me or 22-year-olds, and they think I'm hysterical because I can't do IT at all. And I can't even forward a slide. Good grief. Okay, one of the things that I collected as a part of this process was to see where we were in terms of the public health workforce in Illinois, and I found it fascinating that the Kentucky main PR piece, where they were saying, here's how many we should have, and then they have a chart on the back of how many people are in each of their health departments. Well, guess what? We have that for Illinois now. No, hardly, maybe 5 people have seen this, but we have it. And in Illinois, one of the things that I realized is that some of the smaller health departments actually have a lot of employees. Like Cass County has 60 employees. Cass County has, I'm seeing it right here, 12,000 people living in it, and they have 60 employees. And it's because they have home health, mental health, a dental clinic, and primary care. So it doesn't help to just know what your agency size is. You got to know what services are being delivered. But if you look at just the agency size, not public health workforce, 25 and 34 and 20. So that is what. Somebody add that up for me. That's 79% of our local health departments have 60 or fewer employees. 79%, 60 or fewer employees. So we're small. We've always been small, and we have gotten a lot smaller. I would love to have the data of what this looked like in 2008, because we have shrunk so much in the last 10 years. I had worked in local health for 25 years in Illinois, and I was stunned when I saw this information. Totally stunned. Okay, so let's see if I got this right. So one of the things then, I went back and said, Okay, we've got all these different agencies providing different services other than public health. 40% of our local health departments do something fairly major in another area. So, so we said, as a committee, they said, Miriam, we need to know the public health workforce. So they sent me back out there to ask that question, and it's only taken 6 months to collect this information of just how many employees do you have. So total Illinois public health workforce, 4,776 people, 3.7 per 10,000 people, and that's everybody. So this is the public health workforce, but in an agency, that's the secretaries, that's the administrator, that's the fiscal person, that's everybody that doesn't work in dental, home health, etc. Okay? So when I asked that question, I didn't ask what their functions were. I asked, how many do you have in this other category? Okay, and then I subtracted that from their total. So 3,600 of those work at the local level, a little over 1,100 work at the state level, and if you talk just about public health workforce, 70% of our local health departments statewide have 30 or fewer people in their public health workforce. Again, very broadly defined public health workforce. And there are only 2 agencies in the state that have more than 300 public health workers. And it's Chicago and the State Health Department. Now, Lake County is the largest health department, but they have an FQHC. When you layer off their FQHC and their mental health workers and all of that, it's less than 300 people. So I wanted to kind of get a sense of who we were. Or I didn't get a lot of detail, but I think even just the numbers are telling. Other things that we found, no big surprise, our current system is disjointed. Why would it be anything else since we've experienced budget crisis and we knew it was disjointed to begin with? And it's not effectively meeting the needs. As Guddi said, we have a lot of emerging issues, opioids and all kinds of things, and we're not necessarily pushing trainings out on those new emerging issues. All the barriers that were identified in 2014 were still barriers: time, money, staff, system not addressing needs and emerging issues. But it's become so difficult to send staff anywhere for training, and that's why I think we're saying iTrain could be a really helpful resource for everyone. When we asked about priorities, whether we were asking an association or if we were asking local health departments, we heard system coordination. We need better coordination of the system because things are happening and they don't always match the needs locally. They don't match the time frames locally. I mean, there's just kind of this mishmash of stuff happening. There are a handful, a dozen or so local health departments that have workforce development plans, but we haven't supported them. They've all, done that journey by themselves. Why aren't we supporting local health departments to be more effective? And so that's part of what I think we should be focusing on, sharing of best practices. We have 37 of the local health departments in Illinois have administrators that have been on their job, have only been on their job since January 1st of 2014. So 4 or less years, 37 of the 97 health department administrators have been on the job less than 4 years. Or 4 years and less. So leadership is an issue, and administrative and management skills. And so we're starting to develop goals around those priorities and around this issue. So do you all have the abbreviated, shortened version of the goals? Okay, so just so you know that you get the one-page version of what is probably a 5-page document. So we do have a longer document that has tasks and activities and additional things on it. So we haven't stopped here, but I didn't think anybody here wanted to read the 5-page document. So I'm giving you the shortened version. So we have identified 4 goals. No big surprise. We think the most important goal is to develop a system for effective use of workforce development resources. And then we've identified 5 things we could potentially do to develop that system. And I'm going to ask you which of those 5 things you think is the most important, and you're going to get to prioritize that. So those 5 things are to coordinate training across organizations and try to match more effectively with local needs, to support local workforce development, to increase awareness and use of online training, and to explore additional certifications through the Public Health Practitioner Certification Board, to provide training to address emerging issues. So those are the 5 objectives we've identified under the first goal. The second goal, offer leadership development opportunities with a focus on skill building around systems thinking, emerging issues, and the Public Health 3.0 concepts that we've been hearing about today. And so the 2 objectives we have there is support skill development related to the Public Health 3.0 concepts and develop opportunities to strengthen the competency of public health leadership skills. Goal 3, provide and promote training on management and administrative skills. We have a long history of doing leadership development in Illinois, unfortunately no longer funded, but we do have a long history of that. We have not done a good job in Illinois of providing skill training on management and administrative skills. Whatever you've learned or whatever trainings you've gone to probably weren't done in an official way. They were probably something you went to something else on. So we think that should be a focus, and specifically picking up on the public health competency assessment and addressing those competencies that are listed in that assessment. And again, you're going to get to vote on which of those competencies we should be focusing our energy on. And then goal 4 would be to nurture and support future public health workforce. And one of the things, there are 2 main reasons this is on the list of 4. One is clearly most local health departments could benefit from some free labor. And most students I now teach, and I'm here to tell you, all students probably could benefit from having more experience. So let's try to make that easier. And I'm really pleased that IPHA is in the process of trying to put together some kind of a clearinghouse or a matching system for that. And Dave Culp, everybody knows Dave, that's his project right now. So he's been putting together documents that will help us with that clearinghouse. So that's there. So one of the reasons this is here is because we need to, it's a way to shore up some of our needs for more staff. The other reason is if the university is a CEF accredited university, Council on Public Health, on Education for Public Health, they're required to do workforce development. It is part of their accreditation requirements. I didn't know that. My university is undergoing accreditation, so I knew that, only because of that. And so I think we could do a better reach out to all of those public health programs and partnering with them, helping them do the assessment and workforce development that they're required to do and get benefit from it. So I think that there's some real value there. So that's one of the reasons why that became goal 4. So my questions to you, this is definitely still in the formative stage. Did we miss it? Is there a goal that should be there that isn't there? You can think about it because you get a chance to tell us that on your written evaluation form for this session. So think about it. If there's something that should be there that isn't, we want to know that. Are there, yeah, Kevin?
Well, it's a question that came up in our department a couple iterations through the core competencies. And that is a significant portion of our work are what we we classify as technical support.
Mm-hmm.
Core competencies are for professionals.
Mm-hmm.
The first time out of the gate, we did the core competency assessment. We included our technical folks. We kind of tailored it down. But if you don't understand the question, you're not going to understand the answer.
Right.
The revised version of core competency is a little clearer, but there's still those 3 tiers. So I guess when I'm looking at, the strategy for workforce development, what about our, and I don't mean it in any derogatory way, but we have some people, core competencies, I think calls it a bachelor's degree or above, and they're professionals. But so we have a lot of folks that may have associate degrees that come in. We found that sometimes when people are there, they're coming from various backgrounds, not in public health, it's just a many times they can fall in love with public health. After 2 or 3 years, you're kind of hooked. But is there a gateway or a pathway for those persons to develop into the cores 1, 2, and 3 are all pathway driven. You're level 1, tier 2, tier 3, you move up. But what about the folks that don't even make tier 1? And what can we do for those folks?
Okay.
Because a lot of times they're the backbone of our organization.
That's a good, in terms of the assessment, one of the things that we did in my agency was, that's one of the reasons we included those IT things, because they typically have good skills that way. But I think that that's a really good point, and something that we'll talk about, and how we can, maybe there's a way to add an additional objective here.
And furthermore.
Well, you know what?
I'm tired too, Kevin.
No, I so want to hear.
There's a whole on health equity concept of getting community health workers, people from the community, to work in public health. There's been various models of that out there. Could that be an avenue?
Yeah, that's a good idea.
Bridge build for people in working in public health. A lot of us in our career, that may be how we triggered into it. I stumbled in as a student and worked our way through it.
And again, I think that would be a great objective under Goal 4.
So that was one of my
I think that's a great.
Do we have an idea of the technical staff and who they are? So I'm going to call out Amy here. Community health workers have been a topic at the state level for a while, and the pathways to formalize their education. What other, do we know what those other roles are? Because how can we develop something if
I think they are definitely clerical or administrative support for one.
Well, I would just say, Sophie, I think one thing maybe is looking at the intersection between public health and health care in terms of community health workers, because I think I know when I've heard since for example, the Affordable Care Act passed, I think a lot of you have trained people or maybe had people at your facilities or your departments doing health insurance enrollment and benefit counseling and different things like that. So I think that is, we could go on forever talking about all the different things, but just thinking about that intersection between healthcare and public health.
Okay. Other thoughts on things that need to be added or ways in which we can better align to support local health efforts? Okay, I'm going to ask that question again, but in the meantime, I'm going to give you a chance to vote on some things. So you have stickers in front of you, yes?
I think they're all up in the front.
Okay, so let's make sure you get stickers, and then we're going to share with you what we want you to vote on. This room was not real conducive. Okay. This room's not real conducive to laying these all out in one place, so they're kind of all over the place. So the questions that I'm asking you, and what I think would probably work, is if you kind of just start in a different place and answer different questions so that we're not all on the first question. And I'm not sure these are in order, but let me just, okay. So the first set of questions that I have is on Goal 1, we're going to do Goal 1. Because if we don't do Goal 1 in 4 years, we're going to do another assessment and we're going to be right back where we were in 2014. Only worse. So we're going to try to develop a system. But in developing a system, which of those are the biggest priority? So that's the question there. And then the next question is, for these other 4 goals, leadership development, management skills, future workforce, which of those should we prioritize? You know, if we can only get one thing done, we're going to do system. If we can get 2 things done, which of these should we go to next? And it's not a matter of, you know, it might just be earlier in the process, because, okay. And then I'm asking you, which of the leadership skills do you think we need more training on? So they are chief health strategist, social determinants of health, health equity, cross-sector partnerships, optimal use of data. That is all what you just heard about, Public Health 3.0, systems thinking, change management. And again, we'd like to do it all, but if we can't do it all, because there's no magic wand and no new funding, which of those should we focus on? And then right behind Kyle is management and administrative skills, and those are grant writing, working with government agencies, governance, budgeting, supervision, team building, motivating staff, performance management. Those are the public health competencies for management and administration, so that's where I got those. So we're going to give you like 5-10 minutes. You got your stickers. Does everybody have a sticker? Stickers? Okay. So how many stickers do they have? Okay, so where we are in the process is we're going to talk next week to the Public Health is Stronger Together leadership team.
Glad to see you.
And we'll probably do a similar kind of process, and we're also going to ask, you know, which associations can step forward to do what kinds of things, because, you know, developing a system, just like developing this conference, everybody's got to step forward. This conference came out of Amy Fox from Tazewell saying, you know what, we're missing the boat, we ought to be focusing on this. Do you think we could pull together a conference? And I truly have never been involved in anything as collaborative as the development of this conference. The money came from every one of those players that are on your program kicked in a little bit of money. They were all on the planning committee. I mean, the thing that was, I'm sure, kind of like was nerve-wracking for Amy and was, you know, we never knew the budget because everybody was kicking in money like as we went along, and so it was a little nerve-wracking. Are we going to have enough money to cover this? But it was truly collaborative, and that's what it's going to take to do workforce development effectively in Illinois. We're going to have to get that level of collaboration. So what you said about the system is that coordinating training across organizations and matching with, that's the most important thing that we should focus on, which basically is just what I just said, isn't it? And then also emerging issues and local health department support. So those are, you know, that should be our focus. The next question was, after the system development, and I didn't count the dots, but if you can see that it has to be within a dot or two. You want us to do all 4 goals. Okay, we'll try. What can I say? On leadership skill training, I think it's change management, use of data, cross-sector partners are what we're mostly seeing here. And hopefully in the next day you're going to get a little bit of this. Oh, I want to say, and if you want to explore some of this, I hope you have all heard about the Public Health 3.0 Best Practice Awards, because there are awards available for 5 health departments, $1,000 each, for putting forward a project for moving your health department forward in one of these areas. And Guddi and I are going to be working on that once we finish this other stuff. Okay. And then skills related to administration, motivating staff. Probably, you know what? It hasn't been staff morale. I mean, they read the paper too, right? They know that it's been tough. It's been tough in Illinois, and I'm not surprised that would be number one there. But also team building, so a lot of staff development kinds of things. So those are good. And that's really helpful as we finish out the plan. Now, I told you I was going to ask you one more time. So anything we're missing besides those other components of the workforce that maybe aren't directly, that we will add to number 4, I think. Yeah, Tony.
Nothing to add, but could you just repeat when you think the product will be ready to push out?
Okay, so my contract says I have something done by June 1st. It's not going to get to, but you, dear, can see it now because we do want, maybe we'll put it out on a website or someplace where we can get additional comments. So there are two things on the plan, well, 3 things the plan is. The plan is a description of where we are. It is goals and objectives, and it's an appendix of all these resources. That's really what's going to become available. So we definitely want all of that available online somewhere for you. The hard work is getting different associations to step forward and say, we can take this part on, we can focus more on that, and really getting that collaborative take ownership part. That's what's got to happen in the next month. Yeah. But it doesn't get done in the next month. It's an ongoing process. And it all streams out of PHIST because we truly, truly are stronger when we're working together. And, we can't make it. It's sort of like, do we want to go belly up? No, we have to work together. That's kind of where we are. Just like what Kentucky said, I think. Other thoughts? Yes.
I have 2 things. So it sounds like you're going to put this information online at some point. Mm-hmm. Do you know which website?
It will probably be on IPHA's website since IPHA houses the Workforce Development Committee.
Okay.
And it might be other places as well, but that for sure.
The research that are shared here today will go up with the PowerPoint on IPHA's website afterwards. So
through the public health
right.
Conference.
Yeah, okay. Yeah, and they are like 3 of probably 6 or 7 things that I'm planning to put into the appendix. Or, well, I'm going to submit a draft. There are obviously going to be people who do things to it after my contract is no longer there. Okay. Yeah.
The thing I was going to mention about goal 1 over here, I was torn between the first one and the last one because I think objective 5 is the most important, but it can't happen until objective 1 happens. So I just felt like I need to point that out.
Yeah, I think you're, and at one point, this has already gone through a somewhat of an evolutionary process. We had the emerging issues, we had it as a separate goal. And then we thought probably it makes sense that the system is really focused on emerging issues. And so those are the kinds of conversations we've had with the Workforce Development Committee, which has been really helpful because, and at one point, so we've moved things around a little bit, and we probably will move some things as we have additional input. We're going to add some of the comments. We're going to emphasize some of these things. And, what I see happening is the things you didn't vote for are probably not going to fall off the plan, but they'll be 3rd-year things or 4th-year things, kind of. That's how I see that happening, don't you, Guddi? Does that make sense?
Yeah, but you make a very good point about we can't wait on the emerging issues until the system's built, but at the same time,
I'm wondering if maybe those 2 could just be merged into one objective. We put those together for the purpose of
addressing.
Okay.
Right. But we might obviously have side benefits to promoting workforce development on other topic areas as well. But maybe that'd be a way. Maybe it's too much in one objective. But
yeah. Well, I think we have things other than emerging issues. The leadership, the management. The day-to-day. One of the things that I think is very clearly needed is to have groups come together and say, here are the courses on iTrain that I think entry-level sanitarians should take part in. here are the courses that would be core to on iTrain for management. Here are some of the core. And one of the things that hasn't been mentioned about iTrain that I want to make sure you all know about, having spent a little time cruising that online resource, I think the biggest value we could have is to no longer underutilize the function of developing a plan. If you go on there, you can search through training plans, and the series that Kyle mentioned is under a training plan on 101 Public Health Competencies from CDC. That's a 6-part series, and it's a training plan. There's also a training plan on there that Jackson County Health Department and Champaign put together for their preparedness staff. Why should I have to figure out what my preparedness staff have to get trained on if somebody's already figured it out and put it where I can access it? I think we should have groups of like the Nurses Association, public health nurse administrators should be looking at core things on train for public health nurses. We should have environmental. That's where I think we can really maximize the value of the system and share best practices. Why do each of us have to invent our own darn wheel? You know, we don't. I would say also there's some excellent management courses, and that's one of the things that work group is going to be looking at are management courses on iTrain and making recommendations. There are a lot of trainings on cultural competency, and we all need to do more on cultural competency. So I really think there are some health departments that are utilizing iTrain, but it has been overall underutilized. Some of the local public health workforce development plans that I saw actually had links, and they listed the iTrain courses and they had links right in their plan. Everybody is going to do these 6 courses this year, and you know, if they got a digital copy, they'd go right to that course. So I think there are ways that we can be more effective, and we absolutely have to. So I can't remember how we ended. I think we were going to share resources, but I think we've shared most of them. Is there anything else that you really used, Kyle?
No, I don't think so. I'd be more than happy to talk offline with anybody that wanted to talk more. Feel free to email me and give me a call. I'd be happy to talk more about developing workforce development plan. It can be time consuming and overwhelming, and there are challenges, but I do see that aligning all these resources and being consistent in training across the state is really important.
And I think it helps you. I mean, you're already doing stuff. It helps you have one place to say what you're doing for new staff orientation, one place to say, you know, so I think there's some real value in pulling together in one spot all the different things you're already doing. Two other resources that I want to highlight. MidAmerica Center for Public Health Practice has online resources as well. The Conveying the Value of Public Health Training that Guddi mentioned in her early comments are available there. Also, the Illinois Public Health IPHI Institute has a lot of archived trainings as well. So it's not just things on Train. And for those of you that don't know, Train really is a national resource. So there are like over 4,000 trainings. And it might be that the training on management that you think is hot is the one out in North Carolina. It's not just, you know, there are things from all over the country on there that are, some of them are really fabulous.
Yeah, Miriam, Kyle, I mean, it's kind of a combination question. It can segue off what Nick was driving at. Is one of your goals to have consistency, so like every local health department would have similar training for their nurses, sanitarians, the various job titles, to make it, I don't want to use the word interchangeable,
yeah,
drive for consistency?
I'm not, yeah, I don't personally think it's a matter of consistency as it is a matter of not having to rethink the wheel. So
That's definitely a benefit.
yeah, but I think if we had a group of people coming together with environmental health backgrounds and they're making recommendations, then you don't have to start from scratch. You can take their recommendations, and then maybe your local or your environmental health people do swimming pool inspections too, and there aren't very many that do, and you'd have to have some additional training on that kind of thing. But I don't know that we're looking to make a requirement for consistency. I think we're trying to make people's work easier.
I think you're going to arrive at it if you drive
automatically. I think by default
it will.
you will.
And that's not a bad benefit, but it's not the goal I have in mind.
Yeah, I would
personally.
say that like FAB accreditation, that was the idea was that there was like baselines that you were creating for health departments, and we're hoping that this statewide workforce development plan will provide baselines for where people can go to. It would be great that those conversations have been happening at the national level for years with the public health training centers when preparedness was a big deal through CDC's preparedness work. And what keeps happening is that we are, we're one state, right? But what Chicago needs varies from what St. Clair needs, and what St. Clair needs varies from what Knox needs. And we are aware of that. And so even though your public health nurses might have some baseline that may go across, each of those may still need something a little different. And we want to acknowledge that and give space and place for that.
But I think it could lead toward that because there are a lot of the professions, but they are standardized. Food inspections are standardized across the state. I mean, we've heard the blowback when we're not standardized. Differently across the state. Infectious disease, PPE. There are several things that are probably more technical in nature that are standardized, no matter who you are, where you are. Universal precautions are universal. So those are like technical levels of training, where a lot of these others are skill building and competency building, but they manifest themselves in a technical competency.
Right.
So it could
But
build toward
even just finding a centralized location for those technical trainings was, I mean, I took probably 2 or 3 days just to find, if I'm not an environmental health practitioner, where do I find the trainings for a new sanitarian? I may not know that. And so, when you have a staff member leave who knows where those were, and then you don't know where those are, it can create a lot of time. And so it took me, like I said, 2 or 3 days just to find those technical trainings that a nurse would need, a environmental person would need. And so the consistency, I think, is that let's have those in one place so everybody else doesn't have to do what I did and spend days just looking for baseline trainings.
And the facts are, if we have 37 local health departments we have 9 or 10 that have only been there since in less than a year. Those are people who are walking in. Sometimes the system's in place, sometimes it's fallen apart in the midst of a transition. And so are they having to relook and redo those wheels all over the state? So I think that would be the way I see it, to try to drive people to one place so that people aren't having to figure it out for themselves.
And I think that we're probably still turning over leadership across the state.
Oh, yes,
so
for sure.
Having this in place now, I think, will help us in the future as a state also.
My question kind of lends to that a little bit in tracking the training and then identifying key leaders across the state as we strategize on down the line. We know where these professionals are and if they're excelling and all those things. And then even on the local level, when our staff participates in the trainings, I'm not that familiar with iTrain. My frustration with it a long time ago and why we kind of stopped using it was because I couldn't see what my staff had taken. I didn't know they were supposed to turn in their certificates, but I'm trying to hold them accountable. And
there's still a little bit of a problem. You can see it on an individual person, but you can't say, tell me all the Clay County employees who have been trained. That's not available. And I know when IDPH uses it a lot, and that's one of the things they said that it just...
So I think with any online system, what happens is demand makes it happen, right? So if we have people not using it, then there's no need to create reports. Everything costs money and takes time. So I know that the capacity exists. I know a lot of states that use Train I mean, you can cross-cut all that data, all that data is stored somewhere. You just need to have somebody that can extract it and do something with it. So I think if it was used more and then more requests were made and there was a collective that was saying why we need it, there would be a way to try to help.
So that might not fall in your top 4, but maybe that's a...
Well, it could be part of developing the system and increasing online utilization.
For me, it's part of data optimization, right? So we talk about data as the community. I think we forget that we as public health, we have like all the work that Miriam did and took 6 months, like just acknowledging who we are and what we do, that needs to be documented somewhere too. And you know, these certifications, the number of employees, the level of education, you know, look at all these other professions that have been, you know, you look at nursing, you look at medicine, you look at pharmacy, they are, you know, everything is way more documented and way more, and we just haven't gotten there in public health. And that data is going to be critical as we go forward.
So any last thoughts as we work on this? We'll be finalizing this process. Truly, we would love, if you're driving home and you're like, dang it, why didn't I say that?
And hurry up and text and email you. Take it right
June 1st, I'm out of it. No, my contract runs till July, so. But yeah, we're very much in the process of putting it together, but now's the time to give those suggestions because we're open to them. Hillary?
I just have to say thank you so much for all the work that you put into this, because I know between the public health system as a whole, there's limited time for that, and so for you to allocate time to just do this, it's appreciated.
Let me acknowledge that the funding is coming from MidAmerica.
The regional public health training center.
So they're giving money to IPHA, who is paying my salary, and this is stuff I'm doing in my pajamas. This is good stuff.
Take that image home.
Well, what? You haven't given me your number of employees. Let me send you another email, because I had to do that a few times, and those emails all in my pajamas. Okay. Thank you, Hillary. That's lovely. And I just can't believe in working together more, because it's great to do it when you have resources. It's absolutely necessary to do it when you don't.
Before everybody runs away,
yes.
I know that there's going to be conference evaluations, as Miriam just said. My time, Miriam's time is funded through the Region 5 Public Health Training Center. It would be lovely and greatly appreciated if this evaluation could be completed, since we do have to report back to our funders.
And it does give you, it has a couple additional questions to feed into the workforce development plan. We asked you if there's anything missing. We've asked that several times. But we are also asking if you're currently working with your local university to offer student experiences, are you working with your local university or public health workforce development? So we're kind of wanting to know how much engagement there is. So thank you.